Thank you, Mr. President. Speak to the bill.
Senator has the floor.
I'm very grateful that I had the opportunity to be a part of this process, and I want to speak to it a little bit because our medical marketplace is under some extreme duress, and I think that much of the responsibility in assisting that marketplace will fall to this body. And particularly, we have hospitals, the reimbursement rate that we give hospitals for Medicaid, which is an enormous amount of the work that they do, is 66 cents on the dollar. So the money that they lose in providing care to those individuals is compensated in other arenas. And historically, one of the ways we've done that is to ensure that they have access to high-paying services like imaging to offset the losses that they're enduring to care for the patients that we insure in this Commonwealth. So if we are going to make changes to allow an opportunity for lowered costs, and there's excellent documentation to show radiology performed imaging services provided in the community often can be as much as 1/3 the cost of what they are in the hospital. If we're really going to change the dynamic in our marketplace, we're going to have to find a way to offset those losses. And that's exactly what this Virginia Charity Care Fund does. Charity Care is not only Medicaid expansion, and let's be clear, this is not Medicaid expansion, but Charity Care refers to the amount of money we're paying for the patients that are already insured, that are being taken care of by our hospitals and our doctors for that matter. And what we need to do is find a resourceful way that we can increase those rates in order to help them be whole so that we can improve the marketplace and provide more competition. And this is important for physicians too, because physicians are being absorbed into employed situations because they cannot compete in the marketplace, and having the opportunity to have services for which they can be better reimbursed begins to offset that trend. I don't personally, and I hope everybody in this room would prefer us to have some privatization of health care. I think we have the finest health care system in the world, but we need to have some competition to ensure that that exists. This is a balanced approach to disassembling an archaic system of regulating services in the marketplace that will help us make a real difference in how we provide health care in Virginia. And I hope that the Senate will be able to leverage that argument so that we can make true progress in resolving this problem, because just disassembling COPN will cause untold consequences. We've seen one state that deregulated COPN lost 30% of their hospitals. So we need to have a responsible approach to this, and this bill provides that. Thank you for your time.